Hi. So today I want to talk about back pain. Since 75% of Americans suffer from back pain, I'm sure you know what I'm talking about. Back pain can be really debilitating. It can affect your ability to put on socks and shoes or sit and stand, get up and out of a chair. Um, it can really stop your whole life and affect your mood and your health, and so it's really something we should talk about. What does back pain look like? It can be muscle aches from overworking and tired muscles. Like, I spend most of my day hunched over. A lot of people do a lot of lifting, and they're not necessarily lifting with their legs, or they do it all day and it gets tiring, so your back starts to ache. Stiffness from stagnation, just from sitting in a chair, sitting at a computer, sitting in meetings, sitting on a plane, sitting, or even just standing for too long, just not getting movement in your spine, basically. Muscle spasms. A spasm is like a cramp. We all know what a cramp is. It's like a Charlie horse. It hits you, it hurts really bad, it goes away after maybe a few minutes. A spasm lasts for a long time. It hits you, it hurts, it's debilitating, and it pretty much stops your life. I am recovering from a back spasm that I had a month and a half ago. My psoas still is in spasm. I had my first spasm when I was 12 because I fell on my head when I was a gymnast. These are common. I've had a few clients come in the past few months that had back spasms, and doctors really left them feeling very hopeless. So that's a big problem. Shooting and stabbing pain in your back can come from nerve impingement, from a ruptured disc or bulging disc, and you can feel that in your whole body. And also piriformis syndrome, which is like sciatic pain from a piriformis that's squishing your sciatica nerve. All of these can come from overworking, injury, pulling or straining a muscle. You may not realize that you have a pulled muscle or ligament. And inflammation. Inflammation is actually a healing process, but it can also come as a result of high cortisol levels or poor nutrition. If you're eating foods high in inflammatory foods, like processed sugars, dairy, excess meat, wheat, too much of it, and it's basically like trying to fix a problem that doesn't need to be fixed. Your back's fine, but you're having all of these inflammatory things going on because you're not taking care of yourself the right way, which none of us do because we're all in our heads all of the time. So ways of treating it, soft tissue work really is the best. If you go to a doctor and you're in a lot of pain, they're going to give you muscle relaxers or painkillers, and that is what leads to the opioid problem. I mean, it leaves you feeling really depressed and hopeless because you're still not able to move and function. It affects your health, it affects your digestion, it affects your mood and your ability to relate to people in the way that you want to. So massage, we have tons of benefits, and I've done other videos where we talk about benefits, but massage specifically for back pain, we release those muscles that are tight, for one thing, but get circulation into those muscles and really help get some movement in there and some love. And a lot of times what happens when you have back pain is there's some kind of imbalance, and so we kind of balance that out. If your psoas is too tight, we release the psoas. If your QL is too tight, get that released. Get the hips released so it's not pulling on the pelvis, rotating it. Work on the fascia that connects your hamstrings and your quads, and open up the chest. Just do the whole thing, get the whole body. Really helps. What does happen though is a lot of people will come in for the massage and their back feels better, and a couple days later they're in pain again. It's because your body is in a pattern and it thinks it needs to be a certain way. So you need to come in every week and get out of that pattern and do your self-care, and then and your back pain goes away. But don't stop seeing your massage therapist. Keep us employed. Anyway, check out my next video on self-care and foam rolling and things that you can do for yourself in between these massages and everything else.